why don't you all sit here, please? So it will be. So, can we start the session? Yes. Yeah. Good morning and greetings to one and all present in this lecture hall and those who joined via Zoom online portal. I, Dr. Shivakumar Vijayaragolu, IIC convener of Narayana Professional Colleges, Nellore, India. So the Narayana Professional Colleges include medical, dental, nursing, pharmacy, physiotherapy. All these 5 colleges together makes the Narayana Professional Colleges. I, with an immense pleasure, welcome you all to this session on building innovation product fit for market on behalf of our organization and our Honorable IIC President and the Dean of Medical College, Dr. S.P. Rao, and on behalf of our Honorable Dean, Nursing College, Dr. Indra Madam, who is presiding this session here, and Dr. Ajay, Dean Dental College, and the principals of Pharmacy and Physiotherapy, Dr. Arunada Baba and Dr. Tirupati Sir. Our IIC means like Institute Innovation Council, is recently got approved from Ministry of Education's Institute Council. So we are happy to share that in less than a month, we conducted 3 activities and this is our 4th one in a row. At this juncture, we would like to record that we are able to march at this pace only because of the support, help and advice of deans from all the colleges. So each and every dean is very supportive to us. Whenever we ask some help, they are ready to help us. And this is the first initiative to unite all the colleges of the Narayana Medical Institution, and we are jointly doing this venture. And I'm very happy, and my heartfelt thanks to Madam and all other deans. So today's speaker, Mr. Arun Sethuraman, hereafter I will call him as Mr. Arun for reference. So he was kind enough and he readily accepted to deliver a talk despite his busy schedule. First of all, thank you, sir. He founded Kraili Healthcare Solutions in 2017 with a mission of to solve post-surgical site infection and to improve the health outcomes and patient experiences. Prior to Kraili, he worked as a president and international group information officer for Stryker Corporation. It is a Michigan, USA-based company, a medical device company, where he set up an organization and led the transformation of technology services for all markets outside the USA through integration with hospitals. He also championed setting up the Asia Pacific MedTech CIO roundtable under the APAC Med umbrella to bring CIOs together to collaborate on industry-wide issues and opportunities. He is also the vice chair for APAC Med Startup Committee Leadership Team, and he also serves as an advisory committee for SMART. SMART is nothing but Singapore MIT Alliance for Research and Technology. So Mr. Arun also hold multiple positions in Merck, it's a German-based company. It's a German company on science and technologies. And apart from this, he owns a prestigious Global Leadership Award for improving the quality of multiple sclerosis, quality of life of multiple sclerosis patients using a medical device. I think for this, he deserves an applause. So he was also held business and technology leadership roles in companies like Nike and GM in all segments of right from the manufacturing till the retail management. So he did this for his education. He did this bachelor's in engineering in electronics and telecommunications from Coimbatore Institute of Technology in Tamil Nadu. Then he went to US and he is an alumnus of Harvard Medical School. And we are very happy and proud to have you here, sir. So he is a perfect example of what an engineer can do to the medicine. So he is owning, to synthesize everything, he is owning a medical device company. He worked in all sectors of medical device company like Stryker, and he established collaboration with many hospitals when he was there. So he is a perfect example for what an engineer can do for a medical field. And this nowadays the gap between the medicine and the engineering is narrowing. And if the bridge is completely, then it will be, and the quality of life of our generation and future generation will be very well. Okay. So with this saying, I welcome our Honorable Dean, Madam Indra Madam, to give a few words about research and innovation. And after that, Mr. Arun will give his talk.
Good morning to all of you, and I am very proud to be standing in front of Mr. Arun Sethuraman and Sivakumar, and I thank our chairman, Dr. Narayana, who has given us a big platform to develop ourselves as researchers and innovative products, and helped us to form IIC in all the nursing colleges and medical college together. And here I want to tell one thing. In our profession, especially health profession, we are very busy with practicing sick people and giving services to the people, where we are lacking for research. And once we are speaking about research, we will be thinking something new, and it is away from our practice. It is not so. Research is based on our observation. Simple. Whatever you are observing, if you are observing 30 cases with one single sign of signs or one symptom, if make it as observational list and publish it as research. We need not to go for thinking more and how to put it, not like that. It is simple word observation. Keep it thinking over it and put it in the paper and go for publication. Your research is coming to one part. After that, there is some other things we will be learning. Once you tasted that publication and your fame and how many people are likes your publication, then you will have interest to publish more and more. Here the knowledge, whatever you are studied and whatever you are acquired during your training period or your practical period, or once you are practicing outside also, whatever you are doing, if you are able to publish from the publication, once you are getting likes like your status or something like that, this publication test will be making you to go for more research. Once coming to innovation, that is not so big thing. Once you are seeing, for example, ultrasound vein detector has been now come into market. Nothing. Nurses, we are finding very difficult to find a vein to insert vein flan. Once the patients are obese or they are very thin or they are collapsed. That time, the doctors and nurses think, what can we do? That time engineers came into place and they said ultrasound or ultraviolet rays can be able to give us. Simple. Now we are able to insert Venflon for very collapsed young people also or very obese people also with much pricking. That is one thing. Like that, once we are inventing, next is we are very poor in marketing. Health professionals, if we are taking, we doesn't know what is marketing. Even practice also, if we are opening 24 hours clinic or nurses clinic, nurse-led clinics, we don't know how to propaganda and how to attract the people from other area and other. The marketing is very poor in our education because we are not reading or we are not practicing it. So in that area, business marketing people are coming. Once you are having some thought, like writers, famous writers, whenever they are having some thoughts, they used to note it down. Note it down, and whenever they are coming into practice, they will be thinking over it. It's once noted, it will be kept in our mind for a long period. Once it is seedling in ourselves, our mind will be getting various sources how to make us a small plant. Once plant has come, many engineers and marketing people we can approach and make ourselves one of the IIC people. That's what I want to tell about this small intro. I request our Arun Seduraman to deliver a speech recording how medical people as well as nurses and dental people can develop very nice instruments which can be marketed, and you can become a not only doctor, not only a businessman, you can become like one of the researcher where we will be getting more famous and other things. Wish you all the best, those who are coming and joining with us. Thank you.
Thank you, ma'am. Really. Or you want me to put a number?
Thank you, ma'am. It was very nice and comprehensive, motivating talk from the madam as always. And what ma'am told is correct. Okay, innovation is not very big thing. We have to find our problem first and then address the problem in a way. And there are people to, we can approach the people if we are firing need. We can address the problem. It can be solved. On behalf of madam and all other beings, I request our honorable guest, Mr. Sethuram sir, to take over the session.
Good morning. Can you hear me okay? Or is it still audible? No. No. Yes or no? Can you hear me okay? Last one? Okay, good. So first of all, thank you very much for the warm welcome. This is my first visit to Narayana Medical, and I'm really impressed with first Mr. Narayana's personal story. I mean, I think you actually told Indra ma'am that PhDs and scientists are not good in selling, but I think you don't have to sell when you create a great product and a great solution. So I think, and all of you here and so many of you on the Zoom channel as well, this is a testament to the kind of service he's contributing to the society. So I'm really happy to be here. There's also a reason why I'm here, which I'll share it with you. First of all, again, thank you to Dr. Shivakumar and Indra ma'am for the warm words of welcome. So I really feel welcome here. So again, thank you. Could also see everybody following the 1 meter social distancing, which is in pandemic terms, this is something really good. So I'm from Singapore now. I mean, I've lived in many countries, but Singapore is currently my home. So there is social distancing, and this is just a commonplace. So it's really great to see that here. Is it okay if I remove this, or yeah? promise to put it back. So this is much easier for me to address everyone. So there's, so first of all, a small tidbits about me. My first job was in Hyderabad, so then the initial Andhra Pradesh. So I picked up a little bit of a Telugu during my first 2 years. And after that, I've lived in many states in India, Maharashtra, Gujarat, Karnataka as well, of course. Now it's back to hearing some good Telugu spoken, so it's really very interesting. As soon as I came in, people were greeting me in Telugu, which is all the more a pleasure to hear. So I'm going to give less talking, but more working. So we're going to really be working in teams. And how much time I have, Dr. Shivakumar? I have an hour? 1 hour? And how do I click this one? Do you have a clicker or something? Okay. Yeah. So my purpose here is, yeah. Let me just test it out. Okay. My purpose here is to at least inspire you, if not share my story on how you, all of you, with your background in medicine, pharmacy, nursing, can make an impact. Make an impact for the betterment of human beings. That's what I'm here. And I've not done much. I'm still a work in progress. The reason I'm here is we are starting a first in human study, medical device study at your own here, Narayana Medical. So this is the first time we are conducting a human study, and I'm really here to kickstart that research. Just to tell Mr. Indra Ma'am also, like we are conducting lots of good research, and you'll be proud to see this is the first place we're going to do the research in India. Okay. You know who's your customer. When a patient comes to you, it's normally you say, look, okay, he's my patient first. But in other aspects, if you're sort of selling a product, the first question we all ask, who is your customer? Why are we here? Right? This question has to be asked first one. Who is your customer? Okay? Now, I would even say, who is your real customer? Sometimes you may come across people in as you interact with them, and they may or may not be your real customer. So we'll go through a journey, how if you want to be an entrepreneur, if you want to solve some of the problems in healthcare, be it any field, the first and foremost thing we should ask is, who is our customer? Because we exist to serve a customer. Okay? How do we know? Say, for example, if you are a customer, I'm the provider. Let's say you are a customer. What do you have? You have a job to do. Say, for example, if you want to get from place A to place B, traveling is a job that you have to do. Or if you have to clear your exams, or that's again, you have to get the coaching. There's a job to be done. Okay? So remember this concept. There's always a need that exists because there's a job to be done. Okay? Let's say you want to write a good manuscript. Okay? That's a writing is a job to do. So what is that? We have a solution. Okay? You want to write? You have a pen. Okay? Fairly straightforward, right? It's a simple example. You want to write? To write, you need a pen. Okay? So just to give you this, you have a job to do, that is, you want to write, we have a solution, that is a pen, and you are willing and able to pay. Okay? That's also important. Fairly straightforward, right? How do you get it? Given different examples, you go Amazon, you just order it. Yeah? So it's a fairly simple example here, which means in this case, if you really look at it, your customer, or my customer, which is you have a need, yeah, you want to write, you communicate the need that say like, hey, I want to really find a solution, I want this. You decide on the product, meaning you decide on which pen to buy. You want to buy a roller pen or an ink pen, because you make the decision. It's important. You know how to use it. Yeah, you can make a decision, but you know how to use it? Yes, you can use a pen to write. Yeah? You have the skill and ability to use it, which means you can write properly on a pen. It may seem like, what am I talking? But when it comes to the medical device, you'll see how much complex it is, right? And of course, from any customer perspective, you have a willingness and ability to pay. You may be willing, but you also have to be able to pay, okay? You make a decision, not somebody else. I want a pen, I know how to do, I know how to use it, I can pay for it, I know where to buy, and I'm going to make a decision, okay? And you transact, which means you go to Amazon, you go to some other place and sell it. I can buy it, right? Which means you take the transaction also. And last point, you benefit from it. See, the benefit is you got the job done, writing, right? Just think about it. Lots of things we do every day. We buy lots of things. We don't step back and think about the complex processes that we take care of in our mind. Okay, all of these things go through in a simple. There's a need, and there is a how to fulfill that need. Okay, so now we'll go to a little bit of a different example with the medical thing. Right. So diabetes. So all of you are medical professionals, so you know how complex and how big the problem of diabetes in India, or even for the matter worldwide, right? I think it's among the top 5 chronic diseases in the world. It's, I mean, I'm preaching to the choir, so I don't have to really explain to you about diabetes. So I've given an example of Singapore. It's a small country, but again, you see, fairly complex. It leads to complications. There's a 1 in 3 chance people will get diabetes in their lifetime. And probably with the lifestyle problems we have in every single country, this is probably similar in India as well. So if you have a diabetes, what do? You're maintaining your blood sugar level is the fundamental thing to keep your chronic disease under control. How you do it? You just have to either prick and then get a drop of blood and do a measurement with this. Or you have a device like this. Abbott's done this, so you put this device in your upper arm, wherever it is, and it gives you a continuous monitoring of your glucose level, right? So which means this gets a little bit complicated, right? It's not just a simple thing. There's always one way. That's more than one way, okay? Remember, your job to do is to keep your blood sugar levels under control, okay? That's a job. Remember the job. All right. Then what do you have to do? You have to first, once you do that, you got to inject insulin. You can inject it yourself, or have some of these insulin pumps that inject a precise dose on your body, okay? Okay, that's just, apologize, it's not very clear. This is part of managing your diabetes is diet control, diet management, right? What you eat, the portions you eat, keeping track of the food. Yeah, this is pretty much, this is for everyone, but especially for diabetics, it's important, right? If you're sort of traveling, what do you pack in your kit? Okay. And this is a very complex, this is a US example, but a very complex way how an insulin injection reaches a customer. right? It's not just simple, you go buy a pen from someplace and then you can do it, right? The point of giving you this may be slightly different in each country, but you get the sense of how complex this problem is, right? So now, use the same example that we talked about with a job to do being writing and you need a pen, right? Now you see who has the need, yes. In your mind, ask this question. The patient has a need. How does it? Does the patient always communicate the need? Mostly yes, but yeah. The patient requires a consultation with a subject matter expert. The patient cannot decide by himself or herself how to manage her disease, okay? How to manage the blood sugar. So needs an expert to do that. Can the patient decide which one to buy? Maybe he or she can influence it, but pretty much the clinicians, which means most of you or all of you, are in the position of recommending, advising, and you act as a subject matter experts. Okay. Okay. So does the patient know how to use it? You may say, look, I'll give you the world's best insulin pump, but if somebody has not that level of education or the expertise, or maybe not able to do for other reason, right? They don't know how to use the product. They can have the skill, maybe, yeah, injecting yourself needs a different skill as well. Willingness and ability to pay. Not everybody can afford some of these patches. I bought the patch and tested it. I'm not a diabetic, but I'm just curious how it worked. So I do conduct some tests on myself as well, which is very interesting. So I have the willingness and ability to pay, but not everybody can do that. So who makes the decision to purchase a product? Is it the patient decides, or the caregiver decides, or the doctor decides? See, you see there are more questions than answers, right? How do you buy it? Even if you want to buy all of this, can you just go anywhere to your nearby grocery store or online, Amazon? Maybe now it is possible, but if you see it, not every country, everywhere, you can just go buy as if you would buy a pen. And last but not the least, who benefits from the product? Maybe keeping the patient under control in terms of the chronic disease may benefit the patient, but also benefits the caregivers as well. So what I wanted to bring to this conversation is it's not a very simple decision like buying a pen, okay? So now let me ask a question. So again, I want some interactive participation here, right? Who is your customer here? Is your customer the patient family? Obviously, this is a US example, but you can relate to it, right? In the government, the healthcare providers, employers, patient advocates. So it's the same in India, except that the roles could be slightly different, but you still have all the people, all the different stakeholders in India also. Yeah. So in this case, who is your customer? The problem is that, so let me state the problem. There is a large population in India suffering from diabetes. Okay, it's true. Who is your customer? Is the government of India your customer? Because at a national level, if you really look at it, the demographic dividend is not there because huge amount of population is suffering from a chronic disease. Is a patient your customer because he or she is the one that has the problem, right? Is a caregiver your customer because sometimes the patient may not be able to do it. So you're targeting, hey, you know, the son or daughter of an elderly patient to say, look, your parents could benefit from this automated blood sugar monitoring. You don't have to prick their finger every day, right? 5 times a day, not every day, 5 times a day, right? Can you give me some thoughts? I promise it will be a little bit more, even more interesting subsequently. Who's your customer here? Brilliant answer. Absolutely, that's the right answer. All of them are your customers. Absolutely. So in this case, remember the previous example, you need to write. So I just have to really say, look, you want a pen? I'll give you the pen. Yeah? So it's a fairly straightforward. In this case, you see, everybody is your customer. And the interesting part is, each of them may have a different point of view. For example, if the patient is paying from her own pocket, she may go for the inexpensive one. If the government is paying for it, to say, hey, I want the best one, the most expensive one. The government may say, look, well, I will give you the cheapest one. See, it is not always everybody is fully aligned on the goal. There are multiple components to the decision process, right? I hope I've given you this perspective, right? In healthcare, it's very important to know you're dealing with multiple customers. All of them may not have the same way of thinking about a problem. Okay. This makes the job very difficult, because if it's easy to do, make a pen, sell a pen. Healthcare, much difficult. So there are some techniques. So I would recommend biodesign. Biodesign is from Stanford. Biodesign. There's plenty of good training materials available. And this helps you, and you can go refer this section, because I want to keep this going. Stakeholder analysis. Who is your stakeholder? What do they really want? How do you find out, right? As an example, another example is a stroke survivor, right? So the case in point is, you have a diabetes stakeholder map. So you've done a job, you've talked to all the people, the patient, the caregiver, the doctor, everybody else. So say you have drawn who is doing what, then you change, I want to do for stroke. You cannot just take the same example and convert it to say what works for diabetes will work for stroke. Obviously different players, different set of expectation, different dynamics in the game. Yeah. So this makes it even more challenging, because you always have to constantly think. I cannot just do it once. There are some fundamental principles, of course, but you cannot just copy and replicate to every single problem. You have to understand each problem, all the stakeholders individually to solve a problem. Okay. Again, please feel free to stop me. I mean, I intend this to be an interactive session. Okay. There's another example. There's a lot of good examples in India. Again, I was watching a program called Charcha over the Independence Day weekend, where a simple primary health worker goes and screens the patient, right? I mean, primary health screening is a big challenge in India, right? So I learned this role of Asha. They just go with a simple tablet and they go start screening the patients, and apparently they went screening for cancer, and they found more than 2/3 of the patients they were screening for cancer had high levels of comorbidities as well, especially diabetes and hypertension. So this was not done in a formal way. So I'm saying, all of you in your area of specialization or work, you have to follow the stakeholder analysis in some form or shape. But what I would actually encourage you is to use these resources in a better way, because somebody has done it. There's a There's a Stanford by Design, for example, has done a good job in explaining how to construct a proper stakeholder analysis, right? These are some of the tools you can use it without having to reinvent the wheel. Okay? Here is a slightly mature way of explaining things. Your stakeholders might have interest, and if you look at influence, right? For example, a caregiver is a good example. The caregiver, some caregivers may say, look, they may dictate how a patient does the treatment, because they may have to bring the patient to the hospital. So if you really map these two, low stakes and high stakes, and I can make these materials available to you, that's not a problem, right? So the takeaway for you is, if you have an influencer and who has a high stake, got to give the person a top priority. Not every stakeholder is at the same level. So I've told in my previous statement, in the healthcare business, there are more than one customers and stakeholders, right? I've said, look, it's not a simple black and white, there is more. But having said that, not everybody is the same. So you learn how to prioritize, okay? So there's two different concepts. You have to include everybody, yet prioritize who you deal with, okay? Similar concept, but there's a distinction as well, okay? All right, since Dr. Shivakumar said I did my general management program from Harvard Business School, where they teach everything with a case method, case study method. And some of you will end up going there, but I will give you a little taste of it, okay? So case study works this way. Ideally, I would have given you the materials ahead of time. You'll prepare and come, and we'll have a good, healthy discussion. And one of the interesting things is the professor will stand and point out, come on, now tell me, give me. Thank you so much. All right. So that's called a cold call. So I'm going to do some cold calls as well, okay? This is my company's case study. Now we're getting into a little bit of a detail, right? Okay, so you're all in the healthcare profession. Surgery is still the last resort. Like, if you look at a patient, say someone suffering from arthritis, knee arthritis, years of tolerating pain, loss of function. You really look at sometimes threat to life, but not in the case of a knee. But if you take an example, people spend a lot of time tolerating loss of function and pain before they finally say, look, I'm going to get rid of the pain or get my function back, right? So that's when surgeries come. Surgeries save lives, surgeries restore function, reduce pain. That's the last resort sometimes. If you really look at, the patient goes through multiple handoffs from the time it sees a clinician in the office to say, I'm going to do kind of a pre-operative preparation, to hospital admission, to surgery, discharge, and recover and get better. So remember the goal of the patient. If you remember, very simple thing, I have pain, I have loss of function, okay? The job to be done is I need to get my function back, able to move, no pain, okay? This is fairly straightforward, correct? All right. What happens in an uneventful journey, which means all I'm going is I'm going to go get my surgery done, follow the rehab protocol, I'll get better. It's just, life is very simple. But exercise or surgical site infections are the number one reason for unplanned hospital readmissions. It's a very big problem, depending on which surgery you're talking about and what kind of patient you're talking about. Just to give you a very global perspective, okay? There are about 310 million surgeries that happen every year worldwide. 310 million surgeries is roughly the population of US, or 1/3 or 1/4 the population of India. Just imagine so many people getting surgeries every year. Okay? And 1/5 of those are large open surgeries. Roughly about 60 million surgeries are large open surgeries worldwide. And this itself is a huge understatement because there is more demand for more surgeries worldwide, but 60 million surgeries happen, large open surgeries. And roughly 38% in some cases of all the hospital-acquired infection are due to surgical site infections. If you look at laparotomy or open abdominal surgeries, the incident rates are quite high. Could be anywhere from 15 to 40%. Just imagine 5 people come, 2 of them get seriously infected. That infection could be leading to morbidity and sometimes even mortality rates as well. All things considered, it's a fairly big healthcare problem worldwide. Okay. So why is this a problem, right? So you are medical professionals. So what are the 4 cardinal signs of inflammation? Do you know the Latin names? And then the 4th one? Great. That's the 5th one. Yeah, loss of function. Yeah, that's good. So I think you got it. So essentially, for the last 2000 years, since Celsus, who really got this fundamental cardinal signs of inflammation, that's been the way to detect infection even today. Okay? It relies on clinical observation. Even the Center for Disease Control, CDC, which mostly worldwide everybody follows their guidelines as the gold standard, they said 1, 2, 3, the 4th criteria, clinician says so. That is how exactly it happens today. So what's the problem? The symptoms of infection, which is delayed healing, and inflammation, which is normal healing process, they often are very similar, which means the skin could become red. It's a good sign, more blood is flowing. It could be a little bit warm to touch, which is good. But if it continues to be there, it's bad, right? So it's not always clearly visible, and sometimes people say redness in the skin. There's a dark skin, you can't really see its redness as significant. Okay, it could easily be mistaken for a normal healing. So problem number 2, infection could be brewing inside, but it could be missed. Because depending on how you look at it, depending on the clinician's skill, sometimes the attention, sometimes the clinician may not really do that. It may be done by other professionals, right? So it may be easily missed. And third, and most important thing is, I'm giving you a global statistic, and then we'll come to India here as well. Globally, 2/3, roughly 60 to 70% of the surgical site infections are detected after discharge from hospital. This is a staggering number. If you remember, and you may have experienced some of your family members or your patients wherever, whomever, right? When infection happens, patients are not in a hospital. Most of them are not in a hospital. They are there somewhere else, okay? So that comes just a 45-hour delay. So this may or may not be a huge issue in India, but sometimes it is. From Friday evening, especially say some patient is getting signs of infection till Monday morning, for example, till we get treatment, if it is not detected properly and treated, the risk of death due to infection increases by 4 times. It's all published research and well-published research. So what it means is 3 things are a big problem here, right? 1, signs are not black and white. It's just a lot of judgment calls are there. Number 2, it is not visible clearly because you're using mostly clinical observation and the judgment of the clinician. And third is the time. By the time infection is brewing to extent and treatment happens, it could be too late. Yeah? So far so good? You understand the problem? Yeah? So now the engineer in me looked at this. So I spent 3 years, I started this company 3.5 years ago. Prior to this, I was in a global leadership role with a medical device company, Stryker, where I had access to a lot of people like yourself, clinicians and experts across the globe. Okay. So then some of my other training from Harvard Business School, everything, as Dr. Brahma mentioned, how to market it, how to sell it, how to communicate it. So part of this role is you as medical professionals know this stuff, but you need to be able to communicate it better, right? So what is a big unmet need is a reliable and a credible post-operative wound monitoring system and an early warning system for infection. So if an infection happens, you have to get the warning early. How early? Maybe 24 to 48 hours early, so you can treat the wound infection. Okay? So far, does it resonate with you? So far, you sort of think is a problem and a solution? Nodding heads. All right. I assume silence is acceptance. Yeah. So I want to do an exercise. I will let you do this. Do we have a time to do a 5-minute exercise? Can we do this? Make it interact. Because the point I want to get across to you is just listening to lecture is not sufficient. You have to practice it. It's like, and me giving you this small exercise is not to burden you, but to get the concept across to you clearly, okay? So you've learned some of the stakeholder analysis concepts earlier. I've given you a flavor of the problem, which means so many surgeries happen every year worldwide. 1/5 of those are large open surgeries. Infection is a common occurrence. Why is infection a problem? What is the unmet need, right? So you've got all the background information. This is your Harvard Business School case study, okay? So what I want you to do is either you can do it, I'll strictly go by the 5-minute timer, and I may ask one of the teams to go share your thoughts, okay? 5 minutes, in this case, who's your customer, what's the product, who makes a decision, who uses it, who pays for it, who gets what, what's the value equation. Question clear? There's no right or wrong answer, but I want you to stretch your understanding of the problem and how to solve it using these questions as a guide. Clear? Yes, no? Okay, the time starts now. So, hope it's clear. I want 2 of you, work in pairs, 5 minutes, answer these questions yourself. Maybe we have never done it before, huh? So I'm going to push you a little bit more. Mind you, I will do the cold calling. So I might sort of say somebody, I'll find it well dressed and say, hey, I'm going to pick you to share your thoughts. Dr. Shukma, you have to be the timekeeper. I see it's good. Huh? If there's any questions about the problem, please ask. Dr. Shivakumar mentioned it's an interactive session, so I took the liberty of giving you this exercise. Okay, question? Are you a faculty? I'm sorry, sir, you know the answers. I want the students to try. Of course, sir, you're the faculty, you will know, right? But I think I'll be curious to listen to your perspectives after we pick, if it's okay with you, to one of the students, and then we'll compare. So, because I have a few more slides after this, and I'm gonna close it out and make sure the concepts are, my goal is to get the concepts out to you very clearly, okay? No compromise on the concepts. First step students. I think we got about 3 minutes to go. 2 minutes, 2 to 3 minutes, yes. So you want to be active? Look, it's fun. Don't be nervous. It's going to be fun. There's no right or wrong answer. I think this is a good group. You're all excited, but I would like to see even more noise. I can't hear these conversations. You must be so soft, talking so soft. I can't hear you. It's almost time. So, last 60 seconds, let's say. Time to end this session or time for them to, time for the questions, okay. So I'll take the liberty of another 10 minutes to finish the lecture, but all right. Look, we may not have given you all of 5 minutes, but you get the drift, right? Okay. Is someone willing to volunteer before I do the cold calling? I need a team to put up their hand and say, I'm going to share. Because part of being an entrepreneur is to take some risk. If you don't take a risk and don't expose yourself, you will not get the benefits. So I encourage you to take the risk. There's nothing wrong in taking a risk. After all, you're students and your goal is to learn. Who is willing to share? Minus the faculty. No.
Yeah, here. When
all right. So the dreaded cold call will come if, all right. So you want to share? Yes, of course.
Is the patient
Closer. She's got an undue advantage, by the way. She is our clinical research coordinator for the study. So thank you for stepping up, but yes, you have a little bit of advantage as well. Yes, go ahead.
customer is a patient?
Okay, a little bit closer. Indama. So everybody can hear you.
And the product is the early detector, which detects the surgical site infection.
Yeah.
And who makes the decision to use your product is the clinician.
Okay.
Might be.
Good. Okay. So let me say it for the group, benefit of the group. Who is your customer? Is the patient who has undergone the surgery? Yeah.
Yeah.
Is that what you said?
Yes.
Okay. What is the product?
Early detection.
Early detection system. That's the product. Okay. Who makes the decision to use your product? It's the doctor, the clinician. Okay.
Who uses it is the patient.
Who uses it? The patient. Okay.
Who pays for it? It might be the service provider.
Okay.
It's, by the government or the patient.
That's a good answer. It depends. It depends on the context. It could be the service provider, could be the government. Great answer. Yeah.
who gets what? Mostly the patient or who are all involved in this benefited.
So if you're the patient, what do you get? It's a fundamental thing.
Early detection is decreases the threat of life.
Yes. So if I can paraphrase, patient gets a peace of mind, right?
Yes.
If I'm the one who's going to get the infection, if something is monitoring, and I saw those 3 different things, if the doctor doesn't see me on time, my risk of death is 4 times more. The doctor could miss even the simple signs, right? Which means if a device can help the doctor to treat me better, I get peace of mind. Yeah, it's a good, invaluable thing, especially your job to do is to get better, right?
Yes.
You've been suffering, you go through the surgery, you want to get better.
Makes
And
family
peace of mind is always good. Last one, what's the value equation? A little bit tough question, but try. So let me, thank you so far. Give her a big applause. This is outstanding. Thank you, Rangama. Really good. Yeah. Any other risk takers? Any other ones want to try? Okay. Anyone else? No? So, sir, the faculty, I think, will give you a chance. Yeah.
Not medical college.
No, it doesn't matter. So you are still in healthcare. Everybody is in healthcare. Okay.
Sure.
Great. Thank you.
As she told, but I have a different perspective for this, sir.
Sure.
Customer is not the thing.
That is a good perspective. Yes. Why do you say so?
Because the device what wearable device where the hospital will charge totally invasive of the procedure.
Yes.
The way the patient is going out of the hospital.
Yes.
Wearable device.
Yeah.
So that they reduce the burden of post-treatment of the complication.
Yes.
And at the same time, patient is getting a good outcome.
Yes.
So they are not bothered because they have early detection of this.
Absolutely.
Ultimately, the patient is getting benefited.
Yep.
But the hospital is getting good name.
Reputation. Absolutely. Fantastic. Great point. Yeah.
So the product is wearable device.
Yeah. Wearable device. Yes.
Something like I've seen your website, sir. So
Yes. Okay.
Transparent. Who makes the decision is again the hospital makes the decision.
Yeah.
Because whoever is getting treated, so they give this wearable device and send that patient.
Yeah.
Who uses it? Hospital buys and uses by the patient.
Okay.
Pays for it, hospital pays for it.
Okay.
Who gets what? Hospital gets good reputation.
Yes.
Patient gets less pain and early detection.
Yes.
So that they are not the sufferers.
Yes.
Value of equation, as you told in the previous slide, the burden of the treatment of the post-surgical infection will get down.
Yes.
And they need not spend more time for those things. And they can invest those amount and those spending hours in other things.
Absolutely. Absolutely. Thank you so much. Thank you, sir. Yeah. See, same set of information we gave to 2 different teams. Anybody else wants to take a shot? Any other different perspective? It's your learning. Okay. Anybody else? I'm sure you will have these conversations in your class somewhere. But these 2 examples, you said, who benefits from it, right? The hospital benefits from a reputation. Of course, the reputation is everything. Clinician, doctor, if a doctor's patient always gets the infection, what they'll say, this doctor is not doing good surgery, right? Because part of the reason patients get infection is not just the infrastructure, but the surgeon's skill as well. How do they really suture it? How do they really take care of all the procedures? I mean, you are medical students, you would know that, right? Whoever is paying for it, whether insurance company is paying for it or you're paying from your own pocket, nobody wants to pay more than necessary, right? So there is value for every stakeholder, right? So I thought this was an exercise. So whether you exactly have the same answers or perspectives, but definitely you will get the tools how to analyze it, right? So you have a problem, you get the background information, you analyze it, and then you say who gets what, right? How to reach your customer. So I think I'm going to skip through these slides, but this is for a little bit of an advanced audience. Once you've decided, I'm going to make a medical device or a solution, how to reach to your customer. Because it's not just open up a shop and then you can start selling, right? You have to be prescribed, you have to be first regulated. A regulatory clearance is important. Hospitals to agree to it, clinicians to agree to it. And how do you sell it? Distribution, sell direct. And some of you may end up being part of these stakeholder ecosystem as well. Okay? So somebody from the pharmacy background could be part of some of these ecosystem players as well. So I'll skip this. So it's a go-to-market option. If you have, how do you take your product to the market, right? I think Indra ma'am mentioned about selling, doing good at it. You just go direct, or you just go through, how do you price your product? How do you really charge a premium for it? I think the faculty mentioned about hospital bundling these services. For example, if Narayana Medical wants to be the premium player in this segment, they could say, a classic example is the C-section surgeries. It's a fairly low risk surgery, low to medium infection, and 3 to 5% to 10% maximum infection rate. But the woman that goes through this procedure is under a lot of anxiety, postpartum depression, young baby, you see the young mother's perspective. She goes through a lot. Infection is the last thing she needs. Okay? It's an easily solvable treatment, but infection is the last thing she needs. And if she and her family is willing to pay, how about bundling this as part of your childbirth package to say for the first 2 weeks, not only I'm gonna discharge you home early. I don't want to, because some women don't want to stay in hospital for long. They just want to get home. So there is a way for us to manage the infection without really keeping the patient in the hospital. So these are ways of how to get to your customers, how to package it, price it. Okay. I think more US example, but you talked about who pays for it, the patient could pay for it. Key takeaways for you is when you create a product and solve a problem, you got to think about what's the value you're delivering. Clinical impact for our case, for example, we want to reduce preventable readmissions. If readmissions are happening about 20% of the time, we want to reduce it to 10, even less. Dr. Shukmar mentioned our mission, 3 things: reduce unplanned readmissions, increase patient outcomes, increase patient satisfaction. So all 3 are very important for us. Yeah, so we can skip this slide. Yeah, this is the last slide. In healthcare, especially if you want to be an entrepreneur or a medical device company, or you want to solve a problem, complex stakeholder relationships. You understood that, right? It's not straightforward. You have to think, you have to work on it, all the complex details. So you have to engage with everyone. As I mentioned, not everybody is created equal, but you have to engage with everybody. That's the fine art of balancing. Okay? You can't ignore anyone, but you can't give everybody the same weightage. And last point, it's not only good to create a product, you should know how to sell it, how to distribute it. End of the day, if your product doesn't reach your customer, it's not good. So that's my few points on entrepreneurship and solving medical device problem. Any questions I'm happy to take. And I did mention my company, my startup, just about 3.5 years old. What we do is we have a medical device enabled clinical decision support system to accomplish all of the following: to reduce unplanned readmissions, provide early warning for infection, and thereby improve the health outcomes and patient experience. That's what we do. And we are here to conduct a medical device trial with your patients.
Yeah, thank you so much, sir.
Yeah.
So for our students, you made it very clear that who is a customer, who should pay, and what and about the stakeholders and so on. So to start with, we can have a Q&A session for 5 minutes. Then after that, I will request the dental college staffs to come here to give them memento, and nursing college staff also to come here to the stage after the Q&A session. So it's open for students and faculties to ask any questions if you have. Yeah. To start with, let me ask you one question, sir. Simple question.
Sure.
So you done your general management program in Harvard Business School.
Yep.
After that, you could have ventured into any field. So why did you choose medical field and as a medical device? I would like to know your interest behind it.
Yeah, actually, it's a great question. So from and again, you always like to solve. I like to always solve problems. So if you're an engineer, problem solving is your strength. My training and exposure is in analyzing complex problems, looking at solutions, how to solve the problem. And once you keep doing more, you get good at it. So that's one. Right? Number two, I got actually exposure to a lot of clinicians worldwide. My job with Stryker Corporation, I was responsible for all the countries in the world outside the US and was literally traveling to any country in the world. So much so, sometimes 6 to 10 times around the world I've traveled every year. So access to clinicians across the world, knowing the problems, listening to them. So it gets motivated. I think three, it's a small personal story. I lost my grandmother many years ago due to infection. I said, look, if at all I get a chance to do something using my skills and training, I want to do that. And last point is I've reached a stage in my life I wanted to make an impact. So I said, look, let me do something different, and left my comfortable job of traveling around the globe, being on the plane practically every week. So I said, now I have focused on some big problems, and it's not been easy. The science behind the solution is not easy. If it's been done before 2000 years, people have done it. So what we are trying to do is to combine lots of things. For example, whatever you could do in the bedside, you miniaturize it, so you put it on the patient, then collect the data. That's not just sufficient. So you got to make sense of the data. You have to have algorithms to predict. So my job is not just to say detect it. Oh, you have now. Okay, that's just okay, but that's not good enough. So we have to really look ahead and predict. It's the tougher the problem, it excites me more. This is really a tough problem to solve. That's probably one of the reasons I'm still motivated to do this every day. Yeah.
Thank you, sir. So any other questions?
Any question you can ask. I mean, there's no stupid question. I was, not to compare, I gave a similar lecture last year to one of the major institutes in India as well. I was bombarded and I didn't even leave me outside. And this is a very similar topic. Either I'm not good at communicating this or you're all shy. I expect to be bombarded, giving you a sense of competition. So I did the same lecture to a similar group, 200 people last year before COVID in a medical school in Chennai. Yes. So it's got a combination of optical and electrical sensors. So it does continuously collect key parameters, physiological signals, what we call digital biomarkers, proximal to the surgical site. So it's about roughly 2 cm away from the surgical site. That is good enough to really look at the tissue properties. Let's put it this way. I mean, without going through too much detail, we collect real-time health of the tissue proximal to the wound. And then based on the data, we make these algorithm and calculation to say, if this, and this happens, the likelihood of infection is this percentage. I'm sorry? Pulse oximeter is a very, very basic thing. It only gives you the data. It doesn't tell you anything beyond. The clinician has to say an SpO2 reading of 98 is good, 92 is okay, still not good, 80 is quite bad, right? So that decision is taken by the clinician. What we want to give is provide an index where you could really see a score and then underlying reasons why we give the score. Yeah, fairly similar, but much more advanced than that. Yeah. It's still covered by patent. I will just say temperature, oxygenation, and impedance and other things we do. Yeah. So it's a combination of multiple parameters we do. Yeah. Not one, but we take about 5 markers, biomarkers, and then we blend it. We blend it in the sense and we also combine it with the patient risk factors. For example, an obese patient, diabetic, smoker has a higher weightage for the same parameters than a healthy 35-year-old, for example. An obese smoker, 60-year-old, diabetic, same biomarkers are weighted differently than the same procedure for a younger patient with no comorbidities. Sure.
So the talk was very enlightening, and thanks for that. I'm just curious, like this might be one of the apples that you have in your basket, the infection thing, right? Maybe having many more projects undergoing. So how do you select those problems or this thing? Because infection, as in this case, and your product is going to be global, right? It's not confined to a particular region.
Right.
So how do you select your problem that, okay, this would be a better one? I mean, this will give better prospect to the patients or this thing. And what extent of research, I mean?
That's a great question. So if you see the biodesign, the Stanford Biodesign and programs like this, what they do is they give fellowships to the students to go be at the hospital, observe the patient. I mean, I think if you really ask the clinicians, in fact, Dr. Indra ma'am said, look, I cannot insert the catheter because of this is, see, you ask clinicians, they'll give you 1,000 problems. There's no shortage of problems. There is literally, you cannot see where the vein is. So it's currently do is experience and pick and miss. Engineers said that you can shine a light on it and then it will expose the vein, so you can just poke it here. So how it happened is a great example. Ask, observe, ask questions from a problem statement perspective. So I think basic expertise is required to, and there are techniques like we could use a focus group study or you could simply have a dialogue with the patients or caregivers and collect the problem statements. That's not a big issue. Then map the stakeholder analysis, who does what. So to say, is the problem worth solving? If it is for one person or if it's for multiple people, then you can decide it. Then, you just have to go through, can I connect with other people in this space? They may have answers, right? Portable ultrasound. You could take it on the field and really monitor patients who are at risk of pregnancy, right? So previously, they cannot come to the hospital. You take the hospital or the equipment to the patient. Low-cost malaria. So one, I hope this group is interesting to hear. There's one interesting example of a low-cost malaria detection kit. I was in MIT's 100K competition. It's a very simple thing. There is something in the blood affected by malaria, so they put it through a minor centrifuge and then use magnets to separate the particles, right? So there's a very clear distinction between blood that's affected by malaria and blood that's not affected by malaria. By using a simple magnet, you could really separate these two, and you can say a good determination based on in the field. It's instantaneous. You don't have to send it to a lab and get the results. All you have to do is to extract blood, simple centrifuge, put it on the magnet will give you the reading. Yes or no reading. It's good. I want to give you one more insight. So, and I know it's getting late for you as well. It's not always that you have to go to a big university to collect the problems. So I was talking to a professor at IIT Madras, and she said she worked with indigenous tribes in the Nilgiri Hills. And said, look, they have a very simple way of looking at anemia in young mothers or like pregnant mothers. Said they didn't have all the techniques, but apparently they said like they would squeeze the finger something like this in some specific way, and they would see how much is the redness. So again, there was some studies done to say if you press it like this and hold it for X number of minutes or so, and depending on where the blood is, you can determine the extent of anemia in a woman. This is unscientific, but there is great insights into this indigenous knowledge as well. The engineer in me thought about standardizing it. What if I gave you a simple clip that you can put it in your finger, which is simulating the same tribal knowledge, but I'll make it slightly more reliable and consistent, which would become a clinical tool. Okay? I hope this group looks for inspiration from the society as well. It's not always from Western world. There's plenty in our own community and society. If you're just open to listening, open to observing, and open to solving problems, there's plenty to do.
So yeah, in line with you in this case of anemia, there is a German-based company. They came up with an app. When you take a photograph of your hand with the nails, they can say whether anemia is low, moderate, or severe. So,
right.
Yeah. Yeah. So there is no other questions. We can formally conclude this session. And I wholeheartedly thank Mr. Arun Sethuraman sir for being here for a very highly interactive session and explaining about the need and who is the customer, what is the need, and what is the equation, and about the stakeholders, and how to build an innovation, and how to product the market, which is how to sell the product for the market fit. And thank you, sir. And I also thank our Narayana professional colleges, which includes medical, dental, nursing, pharmacy, and physiotherapy. It's like 5 fingers in a palm. So we all together as a Institute Innovation Council. I thank all our Institute Innovation Council members, staffs, and member students. And I thank all the deans of all the colleges and our management. Thanks one and all. And thank all the students who have been patiently listening to this session. Thank you one and all. Thanks. I request dental college staff, all 4 of you, to please come to the dais. Sir, a small token of love from us. Shield. Please, sir, you facilitate him. You felicitate him, sir. May request nursing college staff to come and give the memento to the speaker, please. Please come, ma'am. You all can come. So these are our Institute Innovation Council members from Nursing College. Yeah, may I request some of the students to come for a group photograph, please? Or like 2 or 3 groups? And come forward, come. Guys, you can come. Please come forward. It's okay. Yeah, it's fine. Yeah. Yeah, thank you, sir. So, thank you all. Thank you. We can disperse. Yeah.